So what I can do is back up and talk a little bit about the standards for patents, which you may remember. Okay, the first trick for patent law is that it needs to be useful. That's pretty easy, right? Most things are useful that you invent. A phone is useful, a coffee mug is useful, computer's useful, desk is useful. So that's a pretty easy standard to meet. The next standard is that it has to be novel. That's a lot of times that's pretty easy. All you do is change one little thing. So then it's novel. So it's not, oh wow, I can get a patent real easy. Well, that's not true, because then the next step is that it needs to be non-obvious. And that's where things get a little tricky. So your invention has to be useful, new, and non-obvious. So that's a very subjective standard. We probably don't need to get into it here. But in the pharmaceutical industry, as you can imagine, it's fairly straightforward. Okay, I've got a new medicine for headaches. It's useful, it's new, and the way the chemical elements are arranged, it's completely non-obvious. Nobody would have thought that it would work as a headache medicine, and so you get a patent on it. But, as you may or may not know, in the pharmaceutical world, the pharmaceutical industry has to go through a lot of hurdles with the FDA. So they get their patent, the patent lasts 20 years from the date of filing, and then they have to hang out with the FDA for a really, 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 really long time. So the Congress has come along and they've added on a little bit of extra time for the patent in the pharmaceutical world because of this regulatory FDA issue that comes up in the pharmaceutical industry. But what happens is it still doesn't last very long. The pharmaceutical companies, they spend a ton of money coming up with a lot of medicine. A lot of the medicines don't actually work, or they don't go anywhere, or they're not safe. So they spent money that goes nowhere. So on this one thing that they get, they want that patent to last as long as possible. So what they'll do is they'll come along towards the end of the life of the patent, and they'll try to tweak it in a way that, again, is useful, novel, and non-obvious. So what they might do is they might try to develop some type of extended release or something. I think that's what they did for, what's the allergy medicine? Claritin? I think that's what they did. So you've got the regular Claritin, and then the one that slowly releases out over 12 hours. So it's new, it's useful, and then they're going to have to make arguments to the United States Patent and Trademark Office that the way that they get it to slowly release is non-obvious. So that's the only way that you have to do some type of modification to your invention in order to sort of build on the earlier one, in order to get anything past 20 or 25 years.